Hello everyone, good day. Let me introduce myself. I am Suhartati Gondowiajo, radiation oncologist from Cipto Mangunkusumo National General Hospital, Faculty of Medicine, University of Indonesia in Jakarta. Currently, I am the president of the Indonesian Radiation Oncology Society as well as the past president of the National Cancer Control Committee, ICARO, and FARO. Thank you for allowing me to talk in this very prestigious meeting. My topic briefly is closing the radiotherapy gap, reflection of national roadmap program from the society in our country. Indonesia is an archipelago country with 17,000 islands, and cancer is one of the highest burden disease globally, also in Indonesia. New cases and mortality rate are expected to increase 65.1% and 76.9% in 2040, with breast, cervix, lung, colorectal, and liver cancer are the 5 most common cancer. The radiotherapy utilization level is around 50%, so 50% of all new cases will need to be irradiated. So based on the data in 2018, there will be around 348,000 new cancer cases and around 174,000 patients need to be irradiated. To ensure radiation treatment for every Indonesian citizen, we calculate the estimate number of machines needed in our country. Using the conventional model, it will become 3 for 3 teletherapy machine. If we use the hypofractionation model, it becomes 268 teletherapy machine, or we can use the old scheme 1 megavoltage per 1 million population, so we will need 270 teletherapy machine. Currently, radiotherapy machine available only covers around 30% of the country's need and projected to be 45.5% at the end of the year. For that reason, IRAS has a roadmap how to close the gap in radiotherapy services within the country. Established in 2010, the roadmap created by the society, IRAS, intends to escalate the radiotherapy services in Indonesia stepwisely. Since that the increased number of machines has to be in line with the increase of cancer awareness for both patients and all oncologists, as well as the availability and rate of implementation of the national multidiscipline guidelines for cancer within the country. Anyhow, it has to be in line also with the National Cancer Control Program. This is particularly done to overcome the gap, with the goal of having 70% of the estimated needed of machine equal to 189 machines in 2035. For evaluation purposes, the roadmap is routinely updated every 5 years to calculate and analyze the project outcome. Within the second 5-year evaluation, currently there are 80 machines available at the end of 2020, and we are 100% on the track of the roadmap. The most important thing is that almost 50% of these available machines on 2020 must be replaced due to machine's lifetime at the year of 2035. So we have to prepare additional budget for another 50 machines for replacement and catch up the latest technology. So it becomes 240 machines needed at the end. Nowadays, there are currently 16 out of 34 provinces has radiotherapy access, in total of 46 facilities with 59 LINAC, 20 cobalt, and 1 tomotherapy. In 2021, it is expected already under the ongoing installation to grow up to 79 facilities in 23 provinces, adding 42 LINAC. So the total will be 122. Here you can see the graph, the number of radiotherapy machines yearly. It is quite significant increase. And how can we achieve that? We use all the way collaborate the government, the private sector, and the army medical sector. Now, just to show that the increased number of the machines are from all sectors, the government, private, as well as the military sector. We can see here, we divided Indonesia in 9 regions for facing the problem of geographic distance as one of the most important factors for referral system in the field of radiotherapy services. How to fulfill every region needed? By calculating the ideal number of machine based on the necessity of the people in that area and its realization. It is also become an important factor to fulfill not only the quantity but also the quality of radiotherapy in that region. To provide the referral system in that region, there are three levels of radiotherapy services based on the equipment, level 1, 2, and 3. The challenge for radiotherapy still on its archipelago states, which haven't met equal distribution, with the most machines are available in the region 3 and region 4. However, until now, there is still no machine in region 9, Maluku and Papua, but it is planned for the next 2 years after the improvement of the infrastructure in that area. So as the conclusion, the roadmap of radiotherapy services within the country is important for every nation to guide how to close the gap of radiotherapy services specifically in their own country. The development of radiotherapy should consider multiple factors such as the geographic distance, density of the population, common cancer, and the awareness. IRAS has been set up 5-yearly roadmap stepwisely to guide and scale up the access of radiotherapy services in Indonesia. And Indonesia is now on the track to close the gap of radiotherapy with 100% fulfilled in the second 5 years evaluation and ready to the next 5-year program. The Radiation Oncology Society has an important role to make radiotherapy services available within the country and accessible in their country through the cooperation among the government, private, as well as the military medical sector. And there are still a lot of homework in the next decade to keep sustainability of the track, close the gap of radiotherapy services in our country through our own roadmap from our society. Thank you very much for your kind attention.